You know, when we think about medicine, we usually think about adding drugs, right, to fix something. But what happens when the prescriptions themselves are the problem? This is a huge deal, especially for older adults. So let's dive into what's called the deprescribing dilemma. It's a really tricky part of modern healthcare. All right, let's start with a real-world case. I want you to meet this patient. She's 82 years old, coming in for a new patient visit. And her main complaints? A really bothersome dry mouth, and she gets dizzy from time to time. Okay, now take a good look at this list of her current medications. The answer to her problems is hiding right there, in plain sight. But here's the catch. Finding it isn't just about medical know-how, it's about teamwork.
So let's fill in a few more details here. Our patient, she has a history of things you'd expect. High blood pressure, some diabetes, pretty common stuff. But about 5 months back, she got diagnosed with urinary incontinence and, you guessed it, started a new medication for it. And ever since then, she's been dealing with these new, nagging side effects. And trust me, this isn't some one-in-a-million case. This is the kind of puzzle that pops up in clinics every single day.
And that's why this patient's puzzle is so important. It perfectly highlights a much, much bigger problem in our healthcare system. See, this isn't about one doctor making a mistake. It's about a gap in the system itself, a collaboration gap that makes giving good care way more complicated than it should be. Okay, so what's the solution? Well, it often comes down to this one key idea, deprescribing. It's kind of the opposite of what we usually think of, right? It's the planned, supervised process of actually stopping a medication, or at least lowering the dose, because it might be causing harm or just isn't helping anymore. This is an absolutely critical tool in caring for older adults, but wow, it is so hard to get right. And here's the real kicker. The biggest roadblock often isn't how complicated the drugs are, it's the communication, or the lack of it. Specifically, the breakdown between two of the most important people on any patient's team, the doctor writing the prescription and the pharmacist filling it. They're basically working in their own separate worlds, and guess who's caught right in the middle? Yep, patients just like our 82-year-old. So how do we know this is the problem? Well, researchers in one study by Cui and colleagues used a really smart way to figure it out. They didn't just blast out a generic survey. No, they set up this really cool interview process. First, they'd talk to a pharmacist one-on-one. Then they'd go talk to that pharmacist's physician partner, also one-on-one. And then, and this is the best part, they brought them into the same room together and basically said, okay guys, let's solve this. And the researchers were super clear about their goal. They wanted to get right to the heart of it all, to figure out what the real barriers are, but also what actually helps them work together. You know, what's really stopping them from just picking up the phone or creating a shared plan for their patient. It seems simple, but it's not. And what they found, well, what they and other researchers have found, is that these barriers are legit. They're very real, and they look a bit different depending on your perspective, whether you're the doctor or the pharmacist. So let's break down what's actually getting in the way. Okay, this is where it gets really fascinating. Check out the difference in perspective here. When you ask doctors what their number one barrier is, they say it's patient attitudes. You know, they're worried patients will push back against stopping a pill they've taken for years. But the pharmacists? Their top problem was way more basic. They literally just couldn't get in touch with the doctor. That's a fundamental communication issue right there. All right, let's dig into the doctor's side a bit more. Patient attitudes, that's a whopping 69%. And right behind that, no surprise here, is not enough time. I mean, we all know healthcare professionals are stretched thin. You just don't have time in a 15-minute slot to have these really deep, complex conversations about stopping meds. And look, there it is at number 3, that same difficulty communicating. Now let's flip the coin and look at the pharmacists. For them, number 1 at 56% is that communication problem. Number 2 is, again, not enough time. But number 3, this one's a big deal, a perceived lack of trust from doctors. Think about that. Almost a third of pharmacists feel like their expert advice might just be ignored. That's a huge, huge barrier to teamwork.
But, you know, it's not all disagreement. They definitely agree on some things. For instance, about a fifth of both doctors and pharmacists said they just don't have enough specific training on how to do this deprescribing stuff. And almost a quarter pointed the finger at technology, specifically not having access to the same electronic health records. I mean, if you can't even see the same patient chart, how on earth are you supposed to work together?
Okay, so we've laid out the problem, we've seen the barriers from both sides. It might sound a little bleak, but
here's the good news. There are a lot of really smart people and major organizations working on this. They are actively building the tools and strategies to help bridge this exact gap.
And this is just a snapshot of the effort that's happening. You've got the American Medical Association with its Steps Forward program, which literally gives clinics toolkits on how to bring a pharmacist right into their team. Then you have groups like the American Geriatric Society that create these crucial guidelines. You might have heard of the Beers criteria, which is basically a do-not-use list of meds for older adults. One of my favorite initiatives, though, is the Choosing Wisely campaign. It is just so simple and so powerful. It's all about empowering both doctors and patients to ask some really basic critical questions. Questions like, hey, do I really need this test? Or are there simpler, safer options? And my favorite, what happens if we just do nothing? It's about taking a step back, and it's really the heart of smart deprescribing.
Okay, so now it's our turn. Let's pretend we're that perfect collaborative team. We have the tools, we have the guidelines. Let's go back to our 82-year-old patient and see if we can finally solve this puzzle. All right, let's start with a real-world case. I want you to meet this patient. She's 82 years old, coming in for a new patient visit. And her main complaints? A really bothersome dry mouth, and she gets dizzy from time to time. Okay, now take a good look at this list of her current medications. The answer to her problems is hiding right there, in plain sight. But here's the catch. Finding it isn't just about medical know-how, it's about teamwork. Okay, let's zoom in. Clue number 1. See that one right there? Oxybutynin. That's the one she started for her urinary incontinence. Now this drug is famous, or maybe I should say infamous, for a type of side effect called anticholinergic effects. It's a fancy way of saying it messes with your body's messengers. And what is the absolute number 1 most common side effect of this class of drugs? You guessed it, dry mouth. This isn't some new mystery symptom, it's a textbook side effect.
And bam, here's clue number 2, glyburide. That's for her diabetes. Modern guidelines for older adults basically have flashing red lights around this drug. Why? Because it has a super high risk of causing hypoglycemia, that's dangerously low blood sugar. And what's one of the classic telltale signs that your blood sugar is crashing? Dizziness.
And look, those are just the 2 most obvious culprits on the list. A really good collaborative team, a doctor and a pharmacist working together, would probably flag at least 3, maybe even more, potentially risky medications here. Drugs that could be causing her symptoms, or, even worse, putting her at risk for a fall. And I really want to stress this point. This is not about blaming anyone. Her primary doctor, the specialist who prescribed that new pill, they're all good people trying to do the right thing. This is about a system that's broken. A system that puts up walls instead of bridges, making it so hard to see the big picture. And the result is harm that could and should be prevented. So all of this really brings us to what the future of care needs to look like. Fixing this isn't about a new miracle drug or some fancy app. It's about fundamentally rethinking how the whole healthcare team actually works together.
So I want to leave you with a question to chew on. Whether it's for you, or your parents, or a grandparent, in a system where even the professionals find it hard to connect, who is the one making sure the whole team is talking? Who's checking that the primary doctor, the specialist, and the pharmacist are all on the same page? In other words, who's managing your team? Because making sure that collaboration happens, that might just be the most important prescription you can get.